Hi, my name is Claudia and I'm an F2 doctor from Cardiff. Enhanced recovery after surgery is an evidence-based perioperative pathway designed to reduce length of stay, complication rates, and readmission rates in surgical patients. In our general surgery department, we notice a lot of patients going without ERAS medications, often only noticing this after complications had occurred. We asked our current F1s what their understanding of ERAs was, as they are the ones who are clerking these patients and responsible for the prescribing. 71% said that they understood what ERAs was, 0% said they were confident in prescribing the medications, and they rated their ability to prescribe correctly an average of 5.5. Our aim of this project was to measure compliance with ERA's prescribing, to identify trends in prescribing errors, and to implement changes in the department to improve compliance and therefore the patient experience. Data was collected between these dates with a sample size of 39 patients. We used the hospital's electronic prescribing platform to identify patients to see which medications had been prescribed and compared it to the relevant subspecialties to see what components were prescribed correctly. It was marked as incorrect if the medication was prescribed later than at clerking. So we found that 5% of patients were clerked with correct prescriptions and that 28% had no prescriptions at all. Looking a bit deeper into this data, we found that only 66% were prescribed adequate venous thromboembolism prophylaxis. We found that 10% was prescribed correct antibiotics, and we found that only 48% was prescribed their regular medications. Um, our key findings were that antibiotics were either not being prescribed or the wrong ones were being prescribed, that antithromboembolism stockings were not being prescribed, and that regular medications were not being prescribed, and just that there was a general poor understanding amongst juniors as to which patients requires ERAs and what medications they need. We implemented changes such as creating this poster, which basically outlined the prescriptions for each subspecialty, designed with the pharmacists and the consultants. We have also created medication bundles on our e-prescribing platform to streamline this process, and we are implementing a better and more thorough induction to help the F1s understand who needs ERAs and what they need. So in summary, we found that preoperative optimization plays a key role in postoperative recovery, and that clear signposting and education, particularly amongst juniors who are new to the job, can improve compliance and understanding of ERAs. And we aim to re-audit this project at the end of June once these changes have been implemented. Thank you so much.